Hey, what's up guys? It's Ryan with Revolution Performance. I wanted to come to you today with a video about, should you or should you not get an MRI or X-ray or really just medical imaging in general. So this is a topic I'm actually pretty passionate about as a physical therapist. I think there's plenty of reasons and examples of things you guys could think of where an X-ray or an MRI would be indicated and appropriate. And you'd be correct. I mean, those are obviously, advances in modern medicine. I am in no way saying that they have no place. So obviously they have their place. I think the issue I see, especially from my perspective as a physical therapist, is just that those things can tend to be overused. And I'll explain a little bit what I mean by that. But first, an example of when it would be appropriate to use those medical images would be, for example, trauma. So if you have a head injury, you probably would like a CT scan to see if you're, bleeding into your head, right? That'd probably be an appropriate use of that imaging. Likewise, any other sort of trauma anywhere else. So you probably want to know if you have a broken bone that requires surgical fixation or casting or anything of that nature. So that is in no way what I'm talking about. So what I'm talking about is overusing it. So using it for things that where it might not necessarily be, necessary or appropriate. I think the best example there is with low back pain. So, in low back pain, you might hear, through your lifestyle experience, or life experiences rather, or through, someone that has gone through back pain, various, diagnoses, stuff going on with their back. So you start to have pain there, it's not really going away, so you go to see your doctor, and you think you need an MRI. So, they send you to get an MRI, and you get the results back, and it's something to the effect of, degenerative disc disease, or spinal arthritis, or a bulging disc, facet joint issues, all these things. So none of those things sound very pretty, right? But the reality is a lot of those things are what could fall under the umbrella of, normal age-related changes. So the best way to explain that is just that, you have wrinkles on the outside as we age. Those are simply wrinkles on the inside. So, as we age, your spine's not going to be perfect, and those things can obviously be picked up by medical images. But what, sometimes isn't explained, and this is the passion of mine, and I guess a frustration in a way too, is just that those things are normal. So there's been numerous studies over the years that show those things can be present in people as young as teenagers. So you don't even have to be that old for those things to be present. Going back to those different diagnoses, so bulging discs, degenerative disc disease, spinal arthritis, irritation here and there is normal. Sometimes it's not always explained to you that way, or that's just not how you take it. And I think that detriments, you as the patient. So, if those things were there before, how can they be causing the pain that you just started having a couple weeks ago, right? So I think that's what's tough. So as soon as you hear that, obviously beforehand when your back wasn't bothering you, you didn't go get an image, so you didn't know what your spine looked like at that point. Now, when you have back pain, you go get the image and you get these, diagnoses thrown around of degenerative disc disease, spinal arthritis, whatever it is. You then associate that pain with that issue. And the only, issue with that is that, the only way to fix a lot of those things is surgery, when you might not necessarily need surgery. So just because you're having pain does not mean the cause of it is any of those things that they found in your spine on your medical image. And in fact, as a physical therapist, a lot of times all it seems to be is just an overuse of the spine. So if you manage your workload a little bit better, which is something we're really good at teaching, it's usually just overuse. So you're overusing your spine throughout your day, or even underusing it to the point where your spine isn't resilient for your day-to-day activities. But that's a big difference, and a big mindset shift to treat it that way versus going straight for surgery because you think you need to correct a disc issue and whatever. And I'm in no way saying that, there's certain people that don't need surgery. Of course, that is the case. Some people, of course, need certain surgical procedures. That's obviously why surgery exists. And, obviously as a physical therapist, it's tough to speak to that. That's certainly a conversation for you and your doctor or you and your surgeon. But it's tough in a short video like this to even outline that, because this is something I could probably go on about all day, and I about have on this video. This is probably the longest video I'll post, but it's just I hope that helps to change your guys' perspective on that. I think back pain is probably the best example I can give, but there are certainly plenty others. So I hope that makes sense, and I hope nobody takes this out of context either. It is a little short video, so there's clarifications I probably could make here or there. If you do have any questions, feel free to drop some comments below, direct message me, get into contact with me, however possible, and we can talk through some of those things. So thanks guys. I hope you found that interesting, and I hope you have a great day.